Friendly Workplace Initiative in New Hampshire's online training platform. Today, we're going to continue with identifying and supporting employees that are living with substance use concerns. In Module 1 of this training that you've already taken, we revisited the Recovery Friendly Workplace Initiative overview and reasons for joining. And we also discussed person centered approaches to identifying potential employee substance use concerns in your workplace. As a refresher, we covered that employee substance misuse results in nearly 66% of the total economic cost of substance use in New Hampshire, which is over $2 billion. We also identified that talking about substance use and misuse in the workplace or anywhere is often hard to discuss, but also that nearly 1 in 4 New Hampshire adults think that substance misuse is the most pressing issue facing the state today. We covered workplace strategies, including adopting a recovery-friendly approach to talking about substance use concerns, ensuring that a formal process is adopted and codified in workplace policy to enable these courageous conversations about substance use. And remember that while signs of substance misuse may be present, the best way to identify a concern for employees is to talk to them directly using open and honest communication strategies. As we move into this final module, we will identify how to effectively support employees with substance use concerns with a recovery-informed approach. As we begin, and is so critical to the Recovery Friendly Workplace Initiative, including identifying and supporting employees with substance use concerns, it really centers around creating a recovery-friendly culture. Supporting employees that have identified a substance use concern or those living in recovery is an important part of being a recovery-friendly workplace, as you already know. Creating a recovery-friendly culture is a critical part of this process and not only allows you to support employees who identify as in recovery, but fosters an environment where honest conversations about potential substance use concerns are possible, and in fact, may even help to reduce substance misuse in the future across the organization because of this culture. So let's take a deeper dive into the elements of that recovery-friendly culture and what it means for your workplace. As you look around the critical elements, we begin with communication style. It needs to be open, honest, and non-stigmatizing, using perhaps strategies from other trainings around the right way to talk about substance use and recovery amongst your employees and in the community. As you look at culture related to performance, it needs to balance between productivity, perhaps the most important element to many owners or leaders or supervisors, but it does need to balance that idea of productivity while maintaining employee wellness. The two are inexorably linked, and balancing both is better than just focusing on one or the other. As you think of decision making, it needs to be democratized amongst all team members, that everybody has a voice to be heard and can be involved in the decision making process, leading to enablement and ownership amongst all team members across the workplace. Your recovery friendly culture atmosphere, the workplace atmosphere, needs to be centered around compassion and transparency, which will enable those open and honest and non stigmatizing conversations as denoted in the communication style of the culture. The team approach of your workplace needs to be inclusive and collaborative. If you haven't yet, make sure to check out the Diversity, Equity, and Inclusion module as part of the Recovery Friendly Workplace Initiative training. And finally, structure needs to focus on support, not punishment, with clear feedback mechanisms amongst team members, increasingly important when you talk about feedback mechanisms from the team to supervisors. While all of these places or pieces may not be in place at the beginning, it's important to focus on each one because adopting such strategies can help to promote a recovery-friendly workplace and culture. After you identify employees with a substance use concern, which begins with putting in that recovery-friendly culture and fostering courageous conversations, it is paramount that you have the formal plan and policies in place to actually support employees who identify these substance use concerns. And key items should include, but are certainly not limited to, developing recovery-informed leave of absence and return to work policies, communicate often about the importance of employee health and wellness, and establish partnerships with community-based recovery support providers. Let's take a deeper dive into each of these points as key items. Leave of absence policies, which are commonly used under the Family Medical Leave Act for pregnancy and postpartum, bereavement, and other health-related reasons, should really be expanded or developed for the first time if your organization doesn't have one. Policies that allow utilization of the Family Medical Leave Act for engagement and treatment programs for substance use as necessary and relevant for the employee in question with a substance use concern. It's important to note that as you're beginning to identify expanding your leave of absence policy, FMLA allows for 12 weeks of unpaid leave. It doesn't require that they're paid, but workplaces that are able should consider using more flexible paid time off policies, not taking away from your general paid time off, but instead paying for FMLE leave that does involve substance use, treatment engagement, or other recovery support utilization. Doing so can allow employees not to have to worry about paying bills or having other environmental barriers and promote engagement and treatment long term, which should be the goal of such a policy as a recovery friendly workplace. Be sure to consider and be aware of that privacy of your employees is important. Ensure that information about a leave of absence is readily available and accessible by employees without a whole bunch of hurdles. Should also consider a no questions asked, quote unquote, leave of absence policy that leverages additional paid time off instead of unpaid leave, and communicate about your leave of absence policies in all recovery friendly workplace program materials, at employee onboarding, and as reminders when having conversations about substance use with employees as part of the courageous conversation framework identified in the last module. After a leave of absence for treatment engagement and other recovery support utilization, a return to work strategy codified within a workplace policy is and should be used. Employees that are returning to work after this leave of absence for a substance use related reason may benefit from return to work policy that covers both human resource requirements, such as a doctor's note for coming back to work and any restrictions, but also should introduce an element of recovery support. Workplaces may adopt or modify their current policies to ensure employee return to work plans include medical release and overview of any restrictions recommended by the employee's medical and care team, the mutually agreed upon accommodations from the employer, including flexible time off for things such as recovery meetings, outpatient treatment and counseling, and other related items. The length of time, the return to work plan, and how often the plan will be evaluated by the employer and employee, putting into place that consistent feedback and supportive mechanism discussed in the last module. And also, you should consider including optional engagement with a peer recovery support specialist as part of the return to work strategy. While certainly optional and not required, having a recovery plan accompany this return to work strategy can certainly be a benefit to your employees and ensure their long term success within this recovery process and returning to work at the same time. Over communicating the importance of employee health and wellness cannot be understated. It's part of not only creating a healthy and recovery friendly culture, but also ensures that as employees are returning to work after a leave of absence or supporting their and maintaining their recovery long term and being employed by your organization, all benefit from communicating around the benefits of employee health and wellness and how your workplace prioritizes it. At every possible opportunity, employers, including leaders, supervisors, HR professionals, etc., should communicate verbally, in writing, and at staff meetings the importance of maintaining individual health and wellness. You can over communicate this priority by also celebrating, of course, with permission, due to privacy and other related reasons, employee health and wellness achievements, involvement in health and wellness initiatives, and workplace and milestone achievements achieved on behalf of the organization across the team. From the Hero Health Initiative in 2019, you can see on the figure to your right all the different elements that can incorporate health and wellness related communication. Uh, all of these communicated at the right times not only impact employee well-being, but also organizational functioning. This interrelated concept of culture impacting outcomes, impacting well-being, and making a better environment to become recovery friendly as a workplace overall. As you think of all of these different policies being in place, allowing and providing a mechanism to connect employees to community based recovery supports can be a crucial part to make sure that employees can support their recovery long term and return to work successfully. Even with a robust employee assistance program, many workplaces may benefit from establishing formal partnerships with community based recovery supports, which are plentiful in New Hampshire, going back to that continuum of care that was discussed in the first module. And while not every support service may be needed for each employee, a person driven approach, meaning people will need different things at different times, having this range of options can ensure that everyone has access to those person driven supports to help their recovery process when they're identified to be supportive for that individual in question. There's several different types of supports available in communities. Those can include prevention and harm reduction organization, reentry services, recovery community centers, collegiate recovery programs, recovery residences or person supportive housing, medical treatment services, mutual aid organizations such as 12-step programs, All Recovery, SMART. Uh, while all of these are plentiful, many of these may be seen or being heard of for the first time as you're going through this training. But never fear, there is definitely, and I believe 17 across New Hampshire today, organizations that can help you find these other support mechanisms in the community because that is what they do every single day. So if you're just getting started at your workplace, the first step that you should take is to connect to your local recovery community organization so they can help you get connected to the rest. They are an invaluable partner as you're figuring out how to connect employees to community-based supports every day as part of the recovery-friendly workplace strategy and return to work strategy for employees with substance use concerns. As we finish up the module, pulling it all together, what are the two important things at a very high level that you should be focused on as a recovery-friendly workplace? First is to implement a recovery-friendly approach to having courageous conversations with employees about substance use concerns, starting with a recovery-friendly workplace culture adoption using the strategies within the second module. You also need to have tangible resources, policies, and community supports to provide employees after identification of a substance use concern. These include leave of absence and return to work policies, over communicating about the importance of employee health and wellness, and partnering with community-based recovery support providers, perhaps beginning with your local recovery community organization to help you get these partnerships in place. There is so much to learn as it begins to concern with supporting employees with substance use concerns, identifying them, and what resources are available to you. And there are several additional trainings as part of the Recovery Friendly Workplace Initiative, including here on the digital training platform or in person, that you could take advantage of. Be sure to look out for the Recovery and Workplace Wellness Training, the Understanding Substance Use Disorder, Bias, Stigma, and Discrimination Training, and of course, the How to Access Resources in New Hampshire, 211 in the Doorway to learn more. Be sure, as you are continuing your training and your journey to become a recovery-friendly workplace, to connect with us in a variety of different social environments on Twitter, Facebook, and LinkedIn at the usernames and handles on your screen. Thank you, and have a great day.